Hi, my name is Kristen, and I'm a student with the University of Charleston ADM program. Today I'm going to be doing a presentation on peptic ulcer disease. So what is a peptic ulcer? Well, peptic ulcers are defects in the gastric or duodenal mucosa that extend through the muscularis mucosa. The epithelial cells of the stomach and duodenum secrete mucus in response to irritation of the epithelial lining, and also as a result of cholinogenic stimulation. The ulcers occur when the stomach acid damages the lining of the digestive tract. This affects over 200,000 people yearly. If you look to your left in this picture, you'll see a healthy stomach. However, if you'll notice on the right, you have a stomach that shows gastric ulcers within the stomach lining, as well as a duodenal ulcer. The gastrointestinal tract is made up of the stomach, the esophagus, and the small and large intestines. You have an ascending colon and a descending colon. The ulcers are usually found within the stomach or the duodenum, which is part of the small intestine. Okay, so now that you've had a chance to look over that, let's talk about causes. Common causes of peptic ulcer disease can include the H. pylori bacteria. H. pylori bacteria is a bacteria that invades the gastrointestinal tract, causing damage to the protective lining of the stomach and the small intestine. H. pylori can be spread through stool of an infected person by contaminating food or water, usually due to poor personal hygiene. Another cause is due to not washing hands, mostly within fast food restaurant chains. If you look in the picture here, you'll see that the H. pylori infection is invading the stomach, which can irritate the stomach wall lining, leading to a peptic ulcer. In this picture, you can see what H. pylori bacteria looks like within the stomach. Honestly, it looks kind of gross. I wouldn't want that in my stomach. So be sure and wash your hands. Another cause of peptic ulcer disease can be due to long-term use of NSAIDs, such as aspirin and ibuprofen, because inhibition of COX-1 in the GI tract leads to reduction of prostaglandin secretion and mucosa, increasing the susceptibility to mucosal injury. NSAID stands for a non-anti-inflammatory drug. Lots of people take long-term NSAIDs for the treatment and prevention of myocardial infarction as well as ischemic strokes, because they are used as an antiplatelet. Another but rare disorder that can cause peptic ulcer disease is known as Zillinger-Ellison syndrome. because this disease results in too much gastric acid secretion caused by a neuroendocrine tumor in the duodenal wall or the pancreas. This occurs in 1 out of 1,000,000 people yearly. The most common symptoms of gastric ulcerations includes pain in the chest or epigastric area, heartburn, nausea, excessive gas, or even vomiting. These symptoms can increase with eating. Another problem is weight loss with peptic ulcers because of the fear of eating due to the discomfort that follows, such as heartburn, nausea, bloating, and abdominal pain. Therefore, intake is decreased if suffering from these symptoms. You can try doing things to prevent peptic ulcers, such as avoiding coffee, avoiding alcohol, avoiding and having caution when using NSAIDs. Do not ignore ulcer symptoms. Protect yourself from infection by following good hand hygiene and making sure foods are cooked thoroughly. So if you have acid reflux or peptic ulcers, you can limit yourself from coffee, chocolate, spicy foods, alcohol, citrus, tomatoes, and caffeine. 2 things you can do to add to your diet and help with peptic ulcers is drinking cranberry juice or taking cranberry supplements. If you suspect or have symptoms of peptic ulcer disease, you should talk to your doctor. These slides are to show you the things that can help or worsen symptoms of peptic ulcer disease. Once you've spoken with your doctor, if they feel that you have symptoms of a peptic ulcer, they are likely to order a diagnostic test, such as an upper endoscopy, for proper diagnosis. An endoscopy is when a camera is placed through the mouth, down through the esophagus, and into the stomach. This scope allows them to visualize the inside of the stomach, as well as take tissue samples, If a peptic ulcer is diagnosed, then treatment will begin with identifying the underlying cause. If H. pylori is the cause, treatment with antibiotics will be included. However, if the cause is unknown, treatment might include proton pump inhibitors to reduce stomach acid, Prilosec, Prevacid, and Nexium or Protonix. So in summary, peptic ulcer disease is when a sore develops in the stomach or duodenum causing GI symptoms and requires a diagnosis as well as medical treatment.